and welcome. This is Health and Wellbeing, and I am Lois Apasambu. With an increase in various environmental outbreaks, the World Health Organization estimates that more than 13 million deaths around the world each year are due to avoidable environmental causes. This is also largely caused by the numerous climate crises which pose a threat to humanity. Today on the program, we shall be discussing the interconnectivity between how we treat the earth and our health. Our guest today is Mr. Ayeni Adewale, a registered nurse and the CEO of Shaw Hero Healthcare Services. Mr. Ayeni, you're welcome.
Good evening, Lois. It's always nice to be here.
And it's nice having you on the program as well.
Thank you so much.
Well, we're going to go on a short break. When we return, we're going to talk about the interconnectivity of how we treat the earth and our health. Do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite. This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television Star Times Channel 127, Free TV Channel 507, and UHF Channel 38.
Welcome back, and thank you for staying with us. If you're just joining us, this is Health and Wellbeing, and we're going to be talking about the interconnectivity between how we treat the earth and our health. And I told you that Mr. Ayeni Adewale is here to discuss this with us. So straight to the matter on ground, when we talk about the earth and we talk about our health, now when we talk about the earth, we're talking about our environment.
Yes.
And when we talk about environment, we begin to talk about environmental diseases and how these affect us.
Yeah.
But let's start from the top. What are environmental diseases?
Okay, thank you so much. Environmental diseases are the illnesses gotten from our surroundings, through the water we drink, through the air we breathe in, and even the soil that we tread upon. So these are the sicknesses that we contract from our environment.
So what are these various diseases? What are the various types of diseases that we can actually contact or contract through the environment?
Okay, the sources of these diseases could come from chemicals, could be physical, and could be biological. Okay, so if we're talking of physical source of environmental disease, we talk about things that we come in contact with directly that affects our well-being as a whole. If we're talking about chemicals, we're talking about things that we also come in contact with them, but may not be directly. It could be that we inhale them, or probably it's a passive means of we contacting them. So when we're talking about we're talking about the physical, the chemical, and also the biological, could be from the bacteria around that come into contact with our food, and from our food we injected them, and that could also be injurious to our health as a whole.
Now, when you spoke about chemical, the first thing that came to my mind is the kinds of fertilizers that we use.
Exactly.
Yes, so you know that we have synthetic fertilizers, and there has been a push for, okay, we need to take it down on synthetic fertilizers and use more of what do they call it? Bio fertilizers that are actually good for those. Can you just help us broaden more on that?
All right. When back then at home, when we were small, our mothers, we want to devise a means to fertilize their crops in the farm or in the garden. So they gather the feces or dungs of cows, of goats, and they keep it for a while, get fermented, and at the end of it, they sprinkle them onto the leaves and the stems of those plants. And at the end of the day, by one way or the other, it comes into contact of the fruit, into the fruits. And then if after harvesting those fruits, they are not properly washed or cooked, they harbor microorganisms, they harbor bacteria that are injurious, that are not healthy for our health. So when they are not properly processed, and then we eat them or we drink them, they become injurious to our health. Yes.
Now, one of the major diseases, and it has been on the news of late. We have quite a number of diseases. We have cholera, we have Lassa fever. I'd like us to first start talking about cholera because we've had an outbreak of cholera. How do people, or how do we get cholera from our environment?
Okay, thank you for the question. Cholera, first of all, is a bacterial disease, which the causative bacteria is called Vibrio cholerae, and usually gotten from unsanitized environment, especially the ponds, the water which are being dumped, which is not flowing, and then even the soil. So cholera is, like you rightly said, is a disease that we have been battling with for years. So this cholera, when you, in the rural areas, in rural settings, when they don't have access to clean water, and then the environment are not well taken care of, you go to the river, you go to fetch water, and then from that same water, looking at the environment of the water, people come there to defecate, and
People
then at the end of the people take their bath. At the end of the day, rainforest wash all those the debris, the feces into the river, and so they go to the river. You fetch your water, and that same water you give to your children, you give to your family to drink. You discover that when that happened, the microorganism inside the water that has not been well processed, the water wasn't boiled, you just take directly, begin to spread. So they are germs, and when they get into you, they begin to spread, they multiply, and when the immune system cannot handle them, then they weigh down the immune system, and then they come with symptoms and signs of cholera, which could be vomiting, stooling excessively. Most especially in children, it's usually an emergency.
Yes, because I remember sometime last year when there was an outbreak, and because cholera can kill in the fastest of 24 hours.
Exactly.
Just someone that was so fine can in 24 hours just go. There was this story of someone that was actually ill and was stooling, was vomiting at the same time before he couldn't move, and then all of this. And just like you said, it is an emergency.
Yes.
It's something that we have to take very seriously. But in this part of the world, we know that we don't take such things seriously. And that's why it's important that we talk about these things, talking about how important it is that we keep our environment safe.
Definitely.
To understand that, because we need to understand that as our environments are not safe, it actually also means that our health is also not safe. Now, we've spoken about cholera. We also have Lassa fever. In fact, COVID, I don't want to call it the almighty COVID, COVID also is somehow, if you hear the history of COVID, it was also from environmental factors, I would say. Not necessarily in the way that we would see it, but even though the report has not officially been out, but from the Wuhan, China story, it was from seafood.
Yes, consumptions of well-processed
Foods.
foods. Some, even in China that you mentioned, we've seen when they eat raw meat without cooking them, without processing them, just eat raw like that. And that poses a lot of risk in our head because those animals, they sometimes could be carrier. They will not come down with the disease, but when being injected by humans, we become the host, and then at the end of the day, we come down with several diseases that we have been experiencing in this dispensation.
Yeah, now talking about cholera, I'd like us to move a little bit because I would like us to touch quite a number of diseases, most especially as it relates to the environment. And we would like us to also talk about, let's say, Lassa fever. How is this also transmitted, and how does this also come up from the environment?
Okay. So talking of Lassa fever is also a public health challenge. Last year, we had several cases of people coming down with Lassa fever. Okay, Lassa fever is also caused by organisms that are found in animals. Bushmeats, the rat, the bat, they are the carrier of this organism. And so when human beings come in contact with the grains or the feces of this animal, okay, by then they transmit the organisms into humans and then cause injury into our health. For instance, if a rat has Lassa fever, the organism that causes Lassa fever, and a human being killed the rat in the bush, maybe bushmeat, and you take it home, you don't process it very well, you eat it, at the end of the day, and if that animal has probably is the carrier, as believed to be carrier of the organism, and the human being hits, you begin to come down with symptoms which are peculiar to Lassa, and this could be bleeding from the nose, bleeding from the orifices, the hair, having high temperature, having vomiting, abdominal pain. So when this happens, it's actually a public health matter that needs a serious attention.
You know, when you said you begin to bleed from different places, your ear, your nose, it gets so scary because people don't actually know how bad it can be for us with Lassa fever. And you know, most times for campaigns, when people talk about Lassa fever, we talk about the importance of keeping our environments clean, just like we've said, you know, that even making sure the environment is clean so that it doesn't even attract this kind of rodents. It doesn't attract this kind of people. Because some people don't understand that when you fall down with this, you begin to bleed from your nose. Well, not even done with you having to stool and vomit at the same time. Imagine
it's
you
so terrible.
Coming out, spewing out blood from your nose,
From
your
the
mouth, your
orifices,
nose.
That
is. I believe this is something we should also classify as emergencies.
Exactly.
You know, because over time we've seen that if one huge illness comes, take for example COVID, you know, at a point the cases of COVID just took over. It was almost like there was no disease. Over time, in fact, research had shown and studies had shown that there were some diseases that suffered because of the blanket thing that came with with COVID. But there are also things that come with us every day, and just like we said, government does not have to do everything for us. For this is our environment. We have to keep our environment clean. That's where our place as citizens come in. That's where our responsibilities as citizens come in. Another thing, now, you know, you classified different types of environmental diseases. And I think we've spoken somehow chemical, biological, physical. Yes, I would also like us to talk about, I don't know if this is biological or so, air pollution. And most especially, we may not necessarily experience it so much here, but I know at this part of even the country. But I remember some months ago, there was this issue of soot in Port Harcourt. Yes, you know, air pollution. How does this work? So, does it come from biological to chemical, or how does this affect us?
Air pollution can also be categorized based on their sources of air pollution, chemical, physical, biological. Air pollution generally is agents or external sources that affect the integrity or the quality of air we breathe in. All right. So talking of chemicals, some of our industries that generate a lot of fumes and smokes that were not properly channeled, when dispersed into the environment, could be inhaled by those neighborhoods who are, in that environment. And something that people should understand is that when they inhale the fumes of an exhaust, or probably the one coming from the industry, it combines with their blood. There's one content of the body which is called hem. The carbon monoxide combined with the hem carries the oxygen. So when this carbon monoxide combined with the hem, it does not allow it to carry the oxygen anymore. Because where the oxygen should bind, the hem has already taken over them. And then so you see the person coming with respiratory challenges. It could lead to lung cancer. It could lead to a lot of lung diseases. It could lead to upper respiratory tract, lower respiratory tract infection just by inhaling carbon monoxide, which is an unpleasant air pollutant. So when we talk of air pollution, it's actually what we should look into. Research says 21.7 million of deaths came from environmental disease. So, and that is an enormous number. So when we begin to look at how these environmental pollutant affect our health, we begin to take precautions on how we can channel, especially the sources of air pollutions, how we can curtail them, or how we can allow people not to stay in that environment that they have been generated. Another thing, talking of air pollution, is smokers. They physically, inhale directly the smoke from the cigarette, which is, in fact, in the cover, they will tell you smokers are liable to die young. They will even draw the structure of the lungs.
Terrible lung.
And if you're addicted to something, it's so difficult for you to. But with education and awareness, people can gradually be weighing out from. So when you're a direct smoker or indirect, or a passive smoker, you inhale those things, and there are chemicals.
When you say passive smoker or indirect, are they two different things?
No, passive smokers mean that you are not the one smoking directly, but you are around. You are around where the smokers are, and you are directly inhaling some of these smokes. It also affects your lungs at the end of the day.
Whoa, so even if you don't smoke on yourself or by yourself, just being around them also puts you at risk
of lung diseases.
Oh, that's something we should all look out for. And I believe that's why they go to so many places and they say these are no smoking areas, most especially for people that don't smoke, so that at least their health is protected.
Exactly.
Now, when we look at these environmental issues, and like I said earlier, that government cannot do everything for us, because honestly, we tend to want to blame government for everything. Things are not working right, it's government. Things are not going well, it's government. But we also have our responsibility, and that's why we need to understand that with all these things, if we put them in place, it would go a long way in helping our health, most especially as even COVID has revealed to us that healthcare systems are even the most strongest healthcare systems that we thought of in the world, that were thought of were strong. COVID made us realize that they're not as strong as they should be. And most especially for us down here, we know that normally, we already knew that our healthcare system is not so strong. And then putting us at risk with diseases like COVID, most especially. And then we now have environmental issues. We have climate change issues and all of this. It shows us that if we actually do take care of our environment, it helps to reduce the burden on the healthcare system. Now let's talking about our healthcare system. We know for most of these things, when we talk about Lassa fever, when we talk about cholera, there are things that can actually be taken care of in primary healthcare centers. But we have a major problem with our primary healthcare system. What can be done about this?
Well, the issue of primary healthcare revival has been ongoing, but we still have a lot to do, both in the parts of the government and then the part of the citizen. Okay, so in the part of the government, I was in one of the primary healthcare centers where I stay, and then out of the people that were working there, there's only one nurse, and then others are just staff that don't have knowledge about, even the health.
Whoa.
So it's the nurse that coordinates them
Everything.
and coordinates
She's almost
everything.
like the doctor.
No single doctor there.
Oh.
So that's one, manpower. On the part of the government should be able to employ qualified health professionals, both the doctors and the nurses assistants, even dentists, and people who can actually do a first aid treatment for those who need them. So, and secondly, on the part of the government is availability of health equipment. You discover that why even health workers don't want to work in the rural area or primary healthcare settings is because they don't have tools to work with. It's challenging when you know what to do, but there's no tool to do it. It's just as if, so you see them, they keep improvising on what, and sometimes those things may not be the standard, but they just want to attend to the patient like that. So government should do well to make health equipment available and accessible. And then on the part of the citizen is, even while we are still blaming government, they should understand that there are some health conditions that they should go to primary health care centers. Imagine, I was just thinking that immunization cannot be done in tertiary institution, cannot be done in secondary institution. So they are primarily should primarily be within the concept of primary health care. Immunizations, some health challenge, malaria. There's no business. There's no patient who is having malaria. No patient should not go to National Hospital, for instance. Should not go to Gariki Hospital, for instance.
Even secondary.
I mean, secondary hospital. So those minor health challenges should be taken care at the primary level. And so people should understand that when they are sick and they have access to the primary health care center, they should go. And that will encourage the citizen to not do self-medication, because when they are not aware that there's a primary health care center around them, they will resort to self-medication. And that alone is also a major issue for us here in the country. Because people just combine, this works for my neighbor, and then this should also work for me. But they should always seek that medical attention.
Now, talking about medical attention, I'd also like us to discuss seeking medical attention, the options of getting treatments brought to us at home. If we cannot get it at primary health care centers, most especially because at the moment there's still a restructuring. And I need to mention that some time back, the National Primary Healthcare Development Agency just launched the reimagining primary healthcare, and we hope that this gives birth to a stronger primary healthcare system for us in Nigeria. But there are also other options that we could explore, like home care. When COVID came, and then we were realizing that we did not have enough space to be able to take care of people. One of the things that was said was you could stay at home and then you get treated at home. Self-isolate, you would get people that will come and see you once in a while. I'd like us to talk about that, because that's something that could also be an option for us. But that will be when we come back from this short break. So when we come back from this short break, we'll talk about options for us in being able to take care of ourselves even in our homes. Do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite. This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television Star Times Channel 127, Free TV Channel 507, and UHF Channel 38.
Welcome back, and thank you for staying with us. It is still health and well-being, and I've been here with Mr. Ayeni Adewale. We've been talking about our earth and our health, and the interconnectivity between how we treat the earth and our health. Before we went on the break, I said we're going to talk about options for us to be able to take care of ourselves, but basically because for now, primary health care is not so strong, but there are other options for us. And like I said, we're going to talk about home care services, and basically that's what you do. Yeah.
Yes.
I'd like us to start up with the importance of home care.
All right, thank you so much. Home care, it's all about health workers coming into the comfort zone of the patient to look after the patient and then care for the needs which are not urgent. I mean, when I'm talking of urgent, it means usually not emergencies. All right. So the COVID era that we just overcame exposed us to the need for us to actually explore these options. At a time, like you rightly said, there were no space in the COVID centers, and then people were asked to self-isolate, and then people were advised to check their vital signs and make sure and give them instructions on what to do if things escalate. And so that gives birth to the idea that people can actually be looked after even in the comfort space of their homes. And so there are conditions that you don't even need to queue in the hospitals for a long time because one, there is no manpower enough in our hospitals. Sometimes you write your name in the morning, and then the following day you have to come and sit it. So it's sometimes that bad. So some of these minor health conditions can be taken care of at home. And even in our elderly, people living with disabilities, they benefit a lot from home cares because research has found that people living with disability, when they have an home care nurse or doctor coming to look after them, to manage their drugs, to check their vital signs and make sure everything is fine, that elongates their well-being. They feel encouraged. They feel that, okay, someone is actually looking after my health constantly. So even in elderly too, companionship, you discover that sometimes in these urban centers, people go to work and they abandon their older ones at home, and the other one will just sleep or wake up and then feel bored, feel tired, and that is not helpful to their health. They need someone to come and look after them as a companion. They can even take a stroll. They can even, if the patient is on medications, they coordinate drugs. It's time for you to take this drug. It's time for you to take this. What's your vital signs today? How are you doing today? And so that improves their health. Even sometimes it could be minor sicknesses like malaria that are not severe. You've been experiencing some symptoms which are falling. Before it escalates, before it weighs you down, you request for a health worker to come and check up on you, and then do the necessary assessment, and then do the necessary treatment within the care that you need. And so if the healthcare worker comes in and discover that you have to be in the hospital. Then he organizes a referral or an ambulance or link you up to your hospital that you have been assessing care, and then you will be properly treated. But for minor cases, even wound dressings, sometimes for homebound patients that they need to change their catheter, they need their wound to be dressed, they need some injections. Home care has been found to be helpful in meeting the needs of the patient.
So, we spoke about the new reimagining primary healthcare that the National Primary Healthcare Development Agency just launched. And basically, you've just given us a spectrum of illnesses that you necessarily may not have to go to the hospital for. And these are things that could actually be taken care of with, say, primary healthcare centers. Is there a possibility that this kind of home services can be integrated into primary healthcare?
Definitely.
And then how would this help in improving primary healthcare?
Okay, thank you for the question. It's actually the work together. Home care, like I said, it's just like a first intervention, which is also synonymous to what primary health care is doing. You don't really have to be weighed down before you seek medical attention. And so if you're feeling unwell in your body, and then an home care nurse comes and assess you and said, okay, ma, this what you're experiencing, you have to seek the attention of the doctor in the hospital. Don't forget I said that the primary care should be accessible and available. And so that's a nurse or doctor refer you primarily to the primary health care. For instance, if you call us that you are having fever, stomach pain, we will not take you to national hospital or the tertiary health care system, because that could be taken care of. So home care provider are just like a bridge between the client and the primary health care. Okay, so when assessment is done and so, oh, this minor wound you are having needs to be taken care of in the hospital for proper management and proper care. So that to be taken to the primary health care for proper management. So it's just like a bridge between the clients and the primary health care. So there's always an interconnection between the home care services.
I've met quite a number of people that access home care.
Okay.
And most times it just looks like home care is for the affluent, for the rich.
Okay.
It's almost like I cannot afford to tell a doctor to come to my house.
Okay, okay.
And isn't that somehow in a way, because if we're going to be talking about primary health care, it's most time, like we said, available and accessible. When we talk about accessible, for us in this part of the world, we're also talking about the money you have to spend. Most especially because most of us in this part of the world pay for health out of pocket, not like in other places where health insurance helps to cover. Good. And so if it was in that case, it would have been a lot easier. But because now we have to pay out of our pocket, it sometimes makes it look like for people that are not very buoyant, this is a service that I cannot afford. How do we tackle this?
Well, home care, it's not actually expensive as people think. And it's not only for the affluent. It's not only for the rich. If I've been to places that it's just, you just understand the condition of the patient, and then attend to him based on the need at that time. So and it's actually rural settings. It's not in the city. Okay, and then we just call upon, oh, please come and check on this patient, and then the situation of the patient, and you know that, oh, this patient may not be able to afford so much, and so you tailor the treatment based on the need at that particular time. There are some expensive drugs that when you even prescribe, it takes away all the money in the patient, So you just have to tell the patient, these are the drugs available. Can you afford? If you can afford, this is the alternative, which is also very good. Can you afford? And say, okay, yes, I can. And you go ahead. So it's not that expensive as people think, because when you go to the hospital, even sometimes in our private hospitals, the same amount you pay, you may not even be paying up to that, because when you pay for bed charge in the hospital, you don't get to pay for that at home, because it's your home.
It's your home.
Do you understand? So there are a lot of bills you pay right in the hospital that you don't get to pay while at home. So you just have to pay for your medications and then the service charge that you people agreed on. So it's not really that expensive.
Yeah. It's good that we need to clarify this, because so
Yes.
many people actually, so many
Think
people
that
feel
it's
I don't
only-
have what it takes to
Yes.
call a health personnel into my home to come take care of me, because this may be so expensive, you know.
Yeah.
But it's good that this is also an option that people can explore
Exactly.
and all of that. Now, talking earlier, I spoke about health insurance,
Yeah.
and I always like to talk about this because that is one of the ways I believe that can help
Can help.
strengthen
Exactly.
our healthcare system. How can we do this to see that health insurance is effective in Nigeria and available for even the barest, as low as most commonest, I would say, masses?
You know, healthcare system should be accessible and affordable. All right. So if they are available and not affordable,
It's a
it
problem.
limits the people that come to access your care. So health insurance is actually helpful to reduce the burden, financial burden that a patient will be spending. It's designed in such a way that when you're working in certain organizations with government or other organizations, certain amount of your salaries will be reserved for health services. And so when you come, because it's always very good when patient comes to the hospital and has to pay nothing because your insurance have actually covered for it. A lot of people don't understand that it's good, because when sicknesses come, you may not be prepared for it. You may not be financially prepared for it. And so to prevent you from running ether and scatter, when you are insured, it covers for your health at that particular time. So you're working with government, you're not working with government, it's so beneficial because it reduces the burden on you at any particular time that you want to seek for medical attention. So we want to encourage people, if they are not insured. I'm sure there have been awareness ongoing
Of
about reason and need for our health to be put under insurance. And there are companies out there, insurance companies out there, who takes this up, and they have actually been doing well. And so it's just to, even if you are working not under government, you're working for yourself, you can bargain with the health insurance. So I want to be putting this certain amount for my health insurance. And when you are sick, they take the responsibility of everything. So you don't say, okay, I don't work with government, I don't work for people, and no, it's there is what's called a provision for that, for your health to be insured, which is also very good.
Well, thank you very much, Mr. Dewale, and I really appreciate your presence on the program, because it has really enlightened us to quite a number of things, you know, coming
Yeah,
from the
thank you so
interconnectivity between the earth and our health, talking about home care, primary health care, also talking about insurance. This is a lot, this is a whole lot that actually enlightens people on the need to make sure that we prioritize our health most especially. But before we round it up on the program, I'd like you to give a word of advice to our audience out there.
All right, thank you so much. I want to advise us to take our health so seriously, you know, and to always seek for medical attention when needed. Don't indulge in self-medication. It's dangerous in your health. And then when you discover that you're feeling some changes in your body, you're feeling unwell, talk to health professionals and seek for medical attention. And when we talk about environmental diseases, make sure your environment is always tidy, always clean at all time. That prevents the environmental disease. That limits you from the risk of getting sick from these environmental diseases. So environment is very key. Clean, make it clean, and also always seek for medical attention.
Well, thank you very much, Mr. Adewale. We sincerely appreciate your presence.
Thank you so much.
Well, that's the size of our package today. Do remember that Mother Earth is ours, and we have to take care of her for her to also take care of us. Do keep it a date with us same time next week. I am Lois Apasambo. Do stay safe.